So I recently had the chance to virtually visit the National Cancer Institute, and Dr. Sharpless told my team about you and the great things that Massey is doing. So I just knew that I had to come here and see it for myself.
Dr. Biden, you all know that she's already been a very visible member of our community, committed to our care providers and our researchers, and she said, "This is the fight of our lives." I thought that was a wonderful statement. Yes, indeed, it is the fight of our lives for every human life. Cancer affects us all, but it disproportionately impacts minorities, which is exactly why VCU focuses its work on addressing disparities in cancer prevention, cancer treatment, and cancer research.
The best science in the world can only go so far without trust and collaboration and communication with those who need it most. As we're discussing today, the divide between clinics and communities persists. And for a variety of reasons, many Americans are being left behind in one of the most medically advanced countries in the world. And the results are health inequities and lives lost. And we owe ourselves better.
And Massey's work also, I think, illustrates the importance of bringing of centers serving their own communities and doing research to benefit the populations that live in those communities, including the underserved populations. This is critical to ensure that cancer research and the progress we're making is accessible to all Americans, regardless of race, ethnicity, or socioeconomic status.
And I think that concept of NCI designation and what we did 50 years, or the past 50 years, of the cutting edge, innovative science connected to the humanity of caring is what the new cancer centers of the next 50 years will be able to do and make even more progress.
We have been, over the years, able to maintain 30% enrollment of minorities in our clinical trials, and that's something that we are extremely proud of.
I'm excited that I'm here because we are working with our community to figure out how can we reimagine what a cancer center should be. We don't just want to be a place where people come when they're sick. We don't want to be a place that only produces great science, but it doesn't translate to the community. We see ourselves truly as Virginia's cancer center, the cancer center for Virginia.
How could I sort of make a connection between, Dr. Nguyen, so people could hear and see his philosophy and passion at VCU about sort of making sure that you have state-of-the-art, innovative, high-quality sort of research and cancer treatments and cancer trials, and that's what he cared about bringing to the community. So I thought it was very important that he be introduced to Black leaders, and particularly Black faith leaders.
There's always been a reluctance in the African American community about certain things in the medical community. And for Dr. Nguyen to offer himself, plus he shares our experience, it made it easy or easier to establish trust and to have credible sources for dealing with the pandemic, getting tests, and even more so now in terms of getting vaccines and having people that were willing to do vaccines. And I do want to thank Dr. Nguyen.
The Facts and Faith Group, all of you here and all of you watching today are critical to creating a healthier world because you know what's at stake and how to earn trust. You know how to empower the patients who too often feel so powerless. And you are saving lives